What the types of diabetes are. Getting a blood glucose done is very important. Such as excessive thirst, excessive urination, weight loss. Hello, my name is Dr. Ganavi. I'm working as Associate Professor and Consultant Endocrinologist at Ramaya Medical College and Ramaya Memorial Hospital. So today we'll talk about what exactly the symptoms of related to diabetes are and what are the different types of diabetes that we come across in our clinical practice. So the most common symptoms related to diabetes is excessive thirst, excessive hunger, excessive urination, and also weight loss. If you are suffering from any of these complications, then do consult the doctor immediately. So some of the patients, especially in the elderly individuals, they might not present with these classical symptoms. So in case these patients present with a deleterious state or weight loss, so consulting a doctor immediately is important. So now let's talk about what the types of diabetes are. So the types of diabetes can be classified as type 1 diabetes, type 2 diabetes, type 3C diabetes, and also there has been a recent addition to one of the categories called as the type 5 diabetes. So type 1 diabetes is nothing but a condition which is usually seen in children. So it is a condition where there are antibodies which are produced against the pancreas, which causes the pancreatic function to decline. So when this happens, the insulin production, which is produced by the pancreas, tends to come down drastically. So when the insulin comes down, production comes down, automatically the blood glucose increases. So usually these children present again with excessive thirst, excessive urination, sometimes children also present with weight loss. So again, if the children are facing any of these problems, getting a blood glucose done is very important. So the treatment for this type of diabetes, that is the type 1 diabetes, is mainly insulin. And insulin, it is always recommended that in these individuals to be given as a basal bolus regime. That is, we give usually the insulin 3 times of short acting and once of long acting insulin. So that is about type 1 diabetes. So now coming to type 2 diabetes. So type 2 diabetes is a condition where there is insulin resistance. That is, there is insulin which is being produced by the pancreas, but there is resistance to its action. That is, the insulin is not able to function to its optimum level. So again, when this happens, the glucose does not enter into the either the muscles or the fat. Again, this causes the blood glucose to go high. So usually patients with type 2 diabetes also can present with symptoms such as excessive thirst, excessive urination, weight loss, but sometimes they can directly present with complications related to diabetes such as burning sensation of the feet or swelling of the legs, sometimes with facial puffiness. Sometimes patients also present with cardiac complications as well. If any of the patients are facing any complaints such as tingling, numbness of the extremities, and sometimes also they can present with any like urinary tract infection symptoms or any other symptoms related to infections such as cough, cold, sore throat, which is not getting resolved very easily. And if the patients present with recurrent infections also, we would want you to check the blood glucose immediately and consult a doctor. So as I said earlier, there are other categories of diabetes as well, that is the type 3C diabetes. So type 3C diabetes is nothing but where the diabetes is mainly due to the pancreatic problem. So if there are any stones within the pancreas, or if the pancreatic size has shrunken, or if there is any developmental defects of the pancreas, or if there is any previous history of pancreatitis, which could be either due to gallstones or could be due to alcohol consumption. So again, this type of diabetes is called as the type 3C diabetes. So for this type of diabetes, the main management again is insulin itself. So the next category of diabetes, that is called the type 5 diabetes, is in fact called the lean diabetes. Previously it was called the malnutrition related diabetes. So this condition occurs whenever there is malnutrition, which causes the pancreatic function to decline. Again, the insulin secretion from the pancreas reduces. So for this type of diabetes, improving the nutrition becomes the cornerstone of treatment. So this is about the different types of diabetes and the symptoms related to diabetes. And in the next episode, we'll be dealing with what the treatment options are for both type 1, type 2 and type 3C and type 5 diabetes. Thank you.